Remember, nothing discussed or talked about on Dr. Langlois Live is meant in any way to diagnose or treat a specific problem or ailment in your own pet. Only your veterinarian can do that after careful examination of your pet. So if you do have any concerns about the health of your pet, why not give your local and trusted vet a call and schedule an appointment today? And now, on with the show.
Good evening, everybody. Welcome back to the second episode of Dr. Langlois Live. I am Dr. Bryan Langlois. I am the President-elect of the Pennsylvania Veterinary Medical Association, as well as my main job as the Medical Director here at the Pet Pantry of Lancaster County. It is the middle of February. I do apologize for not being able to get on last week, but the animals' lives obviously always take precedence, and we did get stuck with a couple of emergencies, so unfortunately couldn't make it on the airway last week, but we definitely are here. I want to thank everybody for tuning in this evening, and if you happen to be tuning in watching the replay, I thank you for doing that as well. It's going to be another fun episode of all things dental this week. February is Pet Dental Health Month, and we want to make sure that everybody's pets out there have their teeth stay nice and pearly white and be taken care of properly. And I think a lot of people really don't understand how important dental health is for their pet, and a lot of them don't realize there's a major problem until it's a major problem. And that is why, you know, as I've always preached, you definitely want to make sure you go to those yearly exams with your vet, because one of the big areas that we do check all the time is your pet's mouth, and making sure that all of the teeth look healthy and things like that. So that's really going to be kind of the main focus of what we talk about, and we are going to dabble a little bit, see what I did there, into the horse world and talk just very briefly about equine dentistry. I'm actually going to hopefully bring that in a later show that really focuses a lot just on horses in general when we talk a little bit more about equine dentistry. But I do want to, you know, not forget about the horse people out there. You know, it is very, very important, and sometimes a sign of major issues in a horse can be solely because of their teeth. So that is an important thing to remember as well. So we're going to jump right in. As I said, it's Pet Dental Health Month, and as we are live here on YouTube, I'm going to toggle right back to that. You can go ahead and ask a question right here in the little chat box if you like, and I will be happy to try to answer it for you. We are going to dip into Doc's mailbag at the end of the show as well and answer a viewer's question in regards to cats and kind of a weird reaction that they do. But right now, like I said, we are going to jump more right into what's going on with dental health. And one of the big things, you know, that a lot of people ask is, how do I even know if there's a problem with my animal's mouth? And some things are obvious, some things you may have noticed, but maybe just didn't really show up on your radar as far as it being due to your pet's dental health. So let us take a look real quick at signs of dental problems in your pet. And these are all types of things that you are going to want to potentially look at when you are considering talking to your vet about problems with your pet's mouth. So let's take a look at those right now. The first one, obviously, bad breath. I mean, that kind of goes without saying. Most people can pick up on that right away, so it's not even really that much of a secretive sign. So obviously, any kind of sign of bad breath in your pet is a sign that you definitely want to have them checked at your vet and be looked at. If you are working on brushing your pet's mouth or their open mouth breathing, as far as panting or something like that, and you do notice that their gums appear very reddened, irritated, they may bleed a little bit, definitely something you want to have checked out with your vet. Increased drooling. Some people think of this maybe as not so much of a major sign of a problem, but it certainly is something that you definitely want to have looked at and make sure that everything is kind of taken care of from that end as well. Drooling can be a sign of oral problems as well as maybe some other problems, so definitely something you want to check out. If you have a dog or a cat that used to love to play with chew toys, chew on things, chew on treats, things of that nature, and all of a sudden they don't want to do it, or they seem reluctant, and they try to do it but then kind of back away, or look like they want to go at it but they kind of remember it being painful so they won't do it again, definitely want to have that checked out. Lack of appetite or weight loss. So what may be perceived really as a lack of appetite is not necessarily a lack of appetite. What it actually may be is the fact that they want to eat. They have a perfectly good appetite, but they know it hurts. And some animals will overcome that pain just from the sheer hunger drive. Some will not eat because it hurts that much. So that is certainly something to be aware of. If all of a sudden you notice your pet, when they're eating, dropping food, maybe chewing on one side of their mouth, they're trying to shift the food over to one side of their mouth, that's certainly something else you want to potentially look at as a sign that there might be problems with their oral health and dental issues. Sometimes they might even vocalize a little bit when eating. I have seen cats growl a little bit sometimes when they are eating because it hurts, or dogs growl too, and especially if that's something new. Now, obviously, there's something, you know, where we look at with potential food aggression or food guarding. That's a totally different thing. But if all of a sudden, out of the blue, your dog starts eating, and as they're eating, they're growling a little bit, might be a sign that you want to have their teeth checked. Pawing at their mouth, you know, that's another sign. There may be pain there. And we're going to talk a little bit about a very painful condition in cats in just a little bit, which sometimes we do see pawing at the mouth with that occurring. And finally, again, and this is a new sign, not necessarily something they've always done, but reluctance to have their head kind of touch their pet like they normally did. They kind of shy away from it. It may be signs that you have a little bit of some problems going on there. So those are all things that you definitely want to go ahead and, you know, be aware of as far as your pet having problems. And when you go to your vet, when this happens and you're concerned, they obviously are going to try to do as full of an oral exam as we can. Keep in mind that if your pet is painful or sometimes is just very reluctant to have their mouth looked at in general, you're probably going to have to either ask your vet for some sedation that you can give orally, and there's different methods or types of medication that you can give to kind of help calm them for that procedure so we can get a good look in. Or your pet may actually have to be temporarily sedated at your veterinary office, and this is for their protection and, of course, for the vet's protection. We can't look in a mouth that's chomping down on our hands, and if your pet requires a muzzle, obviously we can't get a very good look in the mouth either. So those are all important things to remember, where we are asking, you know, sometimes to go that extra mile with a little bit of sedation. It's really for the pet's comfort and your comfort and everybody's comfort, so we can get as thorough of an exam as possible. And really by doing that, we can determine what is really in the best need for your pet. So a lot of times also when you have your pet looked at, you may see something on your invoice, or you may hear your vet talk about what we call dental disease, you know, almost like it's a dreaded thing. It's not really as bad in a lot of cases as it may sound out. You know, you think your pet is horribly afflicted with something. It's really more of just a descriptive term that we use, and we grade them, and I'm going to show you pictures in a second, usually on a scale of 1 to 4. And that allows us to remember, one, what it looked like previously, and two, if your pet were referred to a veterinary dentist or something like that, this way they know exactly what you were seeing. So it's a way for us as veterinarians to chart things in a record to make sure that we are all on the same page when we look at your pet's dental health. So what we're going to do is look at a quick picture. There are, like as I said, 4 stages of dental disease, and here they are. And there, as I said, graded 1 to 4. Every vet scale is going to be a little different as to what vets consider different grades, so that's important to remember. But we are looking at things. Grade 1, this is very, very mild gingivitis, if that, maybe a little tartar built up on the teeth, stuff of that nature. Grade 2, as you can see, we're getting a little bit more into now the heavier tartar or the harder tartar that we actually call calculus, that you can actually visualize more in your teeth. It's more of that yellowish, greenish, almost like solid coating that is over the tooth, where you can't actually see tooth anymore, and you can see that a little bit on the molars of this dog. Then we kind of move on to grade 3. This is more severe, and you can actually see now some of the gum starting to recess a little bit, so you're getting more into the start of periodontal disease with this, so it's more severe. And then finally you get into grade 4, and there's various levels of grade 4. I've seen really, really horrific mouths, especially in dogs that sometimes are in commercial kennels or have been out on the road as strays for a long period of time, and they just haven't really had any dental care like they are supposed to. So those are all things to kind of remember when you're looking at those types of things. And those are kind of like the 4 stages that we basically look at, you know, when we're examining. And as I said, we grade them that way so that we're able to kind of determine what we saw, especially for going forward with a dental procedure. Don't be too alarmed. You know, if you hear that your dog has grade 1 dental disease, that just means there's a little bit of plaque and tartar. There's probably a lot of things that you can do at home to try to help keep their teeth pearly white and clean, and we'll talk about that in a little bit. But, you know, the other thing that I did want to talk about a little bit quick here, and I wanted to show everybody this, is there's a very, very interesting syndrome in cats. And nobody quite understands why it happens, but it's something that's called feline resorptive lesions, or feline oral resorptive lesions. And I'm going to show a picture and a video here in a second. And this is where, right at where the tooth meets the gum, for some reason, and nobody is still quite sure why this occurs, the tooth starts to actually dissolve. And basically resorb. And this is an incredibly painful condition for cats. It can cause them not to eat, it can cause them to drop food, it can cause them to vocalize or paw at their mouth if it's hit the wrong way. And so I'm going to show you a picture first of something that we normally see with this sort of thing. And I apologize, this is a little bit on its side because it's actually more enlarged and easier to see. But if you look at these cats' premolars, up on the top there, so to the left of your screen is actually the top of the upper part, upper teeth on the side of this cat's mouth. And you can actually see the normal tooth there, but you can see all of that reddened tissue that's all sitting in and around right at the top of the gum line. That is all very, very inflamed gum tissue, because underneath that is actually divots in the tooth and areas of erosion that are kind of pits and stuff like that. And to show you kind of how severe this is, I'm going to play a video here in 1 second. There we go. But I'm just going to bring myself back for a second. There's no sound on this video, mainly because I haven't figured out how to get teeth kind of, or me being able to kind of like override the sound on the video. So I just want you to watch this, and I want you to pay particular attention to the closer to the end of the video. You're going to watch something with this, and this cat is under anesthesia, a surgical plane of anesthesia, and actually has had numbing agents in their mouth starting to take effect and things like that as well. So let's take a look at this video, and then I will be back in 1 second. Alright, we are having a little technical difficulty with that video. Bear with me for 1 second, as I am just going to bring it up again, and this time I think it's going to actually work. But this, as I said, you want to pay attention, especially to the end when you watch what this cat's mouth does. And I think I can get it to work now, so hold on 1 second as we clear everything here. And we've got that. Okay, now, hopefully this should work, so enjoy. Alright, so unfortunately for some reason this video is not wanting to play like it was, but what I was trying to demonstrate was that that cat was actually one that we just did today here at the Pet Pantry, and it was under anesthesia. And again, I do apologize, for some reason this video does not actually want to play. But what you would actually do when you touch those areas right on the gum line, and remember this cat is under anesthesia, you would actually see their jaw chatter, and we call it kind of a chatter response. And that just goes to show how innervated and sensitive that area is, because even under anesthesia there's a nerve reaction there that, you know, if they were awake would be incredibly, incredibly painful for the cat. And the only thing we can really do at that point is go ahead and remove those teeth. That's basically the treatment for it. There's really no medical management you can do in that case, and it is something that, you know, is something that really does need to be done under an anesthetic, obviously, as this cat was. We did remove quite a few of these teeth because of these lesions, and nobody really still quite understands why this occurs. There's a lot of research into it, a lot of theories, but nobody's really pinpointed exactly why. There could be some diet issues related to it. It could be some mineral contents in food. again, they're doing a lot of research on this, and hopefully it is something that we will find an answer for, because I have to say, personally, I have seen an uptick in dealing with cats like this, and a lot of cats that have had these lesions that have had to have major dental extractions because of it. So the next thing that a lot of people may be asking themselves is, what exactly happens when my pet goes in for a dental? My vet says that, you know, we need to have them in for the day for a major dental cleaning, or even maybe some extractions if those are warranted. But what is the whole process from start to finish? What exactly are we doing as veterinarians to your dog or cat? This is going to be a dog in this video, but pretty much the same for a cat, when they come into the vet's office and are left for the day for a dental procedure. Well, we are going to show you that right now as we look at another segment that we call Discussions with Doc. I'm sitting here with a wonderful older gal named River, who is waking up very wonderfully from her recent dental procedure that we did on her this morning. And a lot of you may actually be wondering, what exactly happens to my pet when they do go into the vet for a full dental procedure? Well, we realize that there probably are a lot of questions, and we're going to answer a lot of those questions as we take you through exactly what goes on for a full dental right now.
Okay, before your pet undergoes a full dental cleaning at your vet, he or she will of course have a full exam done, and perhaps even some blood work as well, to ensure that he or she is healthy enough to undergo the anesthesia needed for us to do the procedure. Our pets obviously will not lie on their back in a chair with their mouth wide open for us as vets to do what we need to do to perform that proper dental exam and cleaning, so a short period of general anesthesia is generally needed for a full dental cleanings to allow us to help keep your pet's pearly whites shining bright. After getting that one final check by your vet before anesthesia is started, he or she will get a catheter placed in a vein in their front leg, and an injectable anesthetic agent will be administered, as you can see happening to River here. Once she has been anesthetized, a tube will be placed into her trachea to allow us to both protect her airway and administer inhalant anesthesia for the remainder of the procedure. She is also being hooked up to intravenous fluids that will help keep her hydrated throughout the procedure. A technician diligently monitors her vital signs with the help of a pulse oximeter. Once everything looks good and she is in a safe plane of anesthesia, the dental will begin. First thing that will be done is a quick visual inspection of each tooth, and your vet will make notes as to the problem areas that might be noticed. Next, radiographs are taken of all teeth to look at the tooth root structures below the gum line. This is to make sure that there are not issues your vet can't see with the naked eye, as oftentimes there may be problems with a tooth that can only be seen on radiographs. After that, any hard concretions of tartar that we call calculus will be cracked off the teeth if it's present. Next, an ultrasonic scaler will be used to remove any other lightly adhered calculus and tartar from the teeth. Once all of this is removed, your vet will look to make sure there are not any deeper pockets of infection or periodontal issues, using a probe that measures how deep the probe can be pushed under the gum line. If the probe goes deeper than it should, further examination of that tooth will often be done. Now that all of the teeth are cleaned and scaled, if there are any that need extraction, this will usually occur at this time, with your vet taking care to make sure all of the root segments from each tooth are removed and any further cleaning out of debris and/or infection is done. Sometimes your vet may suture close the openings the tooth roots were in to prevent any food or debris from getting into them and causing infection. These sutures are almost always the type that will dissolve on their own, so you don't have to worry about bringing them back to have them taken out. Finally, after all the cleaning and extractions are done, a final polishing of the teeth is done. This helps smooth out any micro abrasions on the enamel that may have occurred from the scaling. Sometimes a protective gel will also be applied to the teeth to help keep them healthy and the gum line as good as it can be. Once all of that is done, any other medications such as pain medications and antibiotics may be given, and your pet is gently woken up from anesthesia, with that fresh from the dentist clean feeling in their mouth.
So as you can see, there's an awful lot that goes into a full dental workup and cleaning for your pet, and it really is important that if your pet is prone to dental issues, to have them cleaned, usually yearly, but again, it very much does depend on your own pet and the own plan that you create for your vet. So we hope you've enjoyed this little look at exactly what goes into a full dental on your pet, and of course, if you have any questions about it or are looking to schedule a dental with your pet, be sure to contact your local and trusted veterinarian today.
This educational segment brought to you by the Pennsylvania Veterinary Medical Association. For all the most up-to-date information about your pet and your pet's health, or if you need help in finding a vet, be sure to contact them today at pavma.org.
Alright, so hopefully that kind of just gave a brief overview of everything that kind of goes on behind the scenes, kind of what we're doing when we do dentals on your pets, and hopefully that maybe will alleviate a little bit of the anxiety, and as kind of was mentioned in the video, hey, if we could get dogs and cats to lie on their backs a little bit with their mouths wide open and promise not to lose a finger in the process to clean their teeth, we certainly would do that. It just really is safer for everybody involved, and for us to really do the in-depth dental work that we do need to do when we do these, on your pet, to make sure that, you know, they are under full anesthetic. And I realize there's a lot of people out there that balk kind of at the price of these things, but you really are getting a lot of value for the price that you're paying when your vet does a dental prophylaxis, as you can see there, between the x-rays, monitoring the anesthesia, the IV fluids, antibiotics that obviously are usually given, pain meds that are given, all of the expertise that goes into examining each tooth, the radiograph of each tooth, the cleaning, the scaling, the polishing, any kind of gels that are put on. So, you know, while it does seem like quite an expense, it really is valuable for your pet. And, you know, really, we talked a little bit about this last show, but pet insurance. If you can get yourself pet insurance, a lot of the policies will cover routine prophylaxis like that in your policy. So definitely look that up. And this way, you know, you may be paying a little out of pocket to start, but you're going to get reimbursed for that, or your vet's going to get reimbursed for that as well. So that's really important to remember. So then the question always comes up, well, what can I do? And obviously River's case there was a little bit more extreme with a lot of the tar that built up. She came from a poor situation before being adopted out into a wonderful home. What can I do with my animal to try to keep their teeth clean? And there's a couple of things that we definitely do recommend. And if you get them from the time when they're puppies and kittens, I cannot stress enough how important it is to get them used to having their mouths played with, their teeth looked at, things like that, when they're young. So this way it is not a problem later on when you do have to do work and potentially try to brush their teeth. And you can see there's tons of different things out there that you can do to brush their teeth, different toothpastes, films, things, dredges, drinks, things you can put in their drinks, mouthwashes, all of that stuff. Just a ton of different things that, you know, you can sit there and have fun with and try to figure out. And all these things do work. But really what it comes down to is the mechanical abrasion. And a little bit of help sometimes with solutions that help to acidify things to dissolve the plaque away and stuff like that. But they're not going to be miracle cure-alls. You're not going to see, you know, a drastic change with some of these additives that you may see as far as the before and after pictures. Every now and then it happens, I'm not going to deny that, but that's not the norm. Of course they're going to show the best case scenarios on these products when they're trying to sell them and stuff. What really works is just daily or even weekly brushing, if you can do that, and going slow to start. That's another thing that we really preach, is you want to maybe only start with one tooth. And one of the easiest things that you can do, and one of the most inexpensive ways to brush your dog's teeth, is if you just go to the drugstore and get some of the cheapest gauze pads or gauze roll that you can find, the ones that has the nice nubs on it, rub a little bit around your finger, and basically just, you can dip it in a little chicken broth or something like that, so this way that, you know, it's not totally adversive, and then just go in and rub right along inside your pet's mouth along the tooth and gum line. And that takes, so you'll be amazed at how much plaque and tartar that will take off just in doing that little bit. Again, start slow. If you have a dog or a cat that you're just introducing this to, be careful. Maybe start only with one tooth and then that's it. And then reward them with a dental treat or something like that. You can use the dental toothpaste. They do work very, very well. Obviously, there is a huge warning there, though. Do not use human toothpaste on your pets. It's because of the swallowing risk. It's the same reason that when you have very young toddlers that you're teaching to use toothpaste, you don't want them swallowing large amounts. It can be toxic to them. So never use regular human toothpaste on your pets. The pet dental toothpaste that are out there are fine. They work with some good enzymatic action, and usually they're beef or chicken flavored. And obviously they're non-toxic if it is swallowed. They're designed to be that way, so that's really, really important to remember all that stuff. So these things, you know, the different stuff that is out there, I'm not necessarily endorsing or bashing one product or another. You know, just be aware that it's really that mechanical abrasion and that daily brushing, or even weekly brushing if you could do it. We'd ideally love daily, but if you can do it weekly, and that's the only thing your pet will allow, more power to you, and it'll definitely help us out as far as being able to get keeping your pet's teeth as healthy as possible. Another caveat with that, though, is if you do start doing that and all of a sudden they appear painful, all of a sudden they appear like you're seeing bleeding of the gums, things like that, stop. Don't go any further. Contact your veterinarian, make an appointment, have their mouths checked, because that can be the start of something that hopefully we can treat pretty easily, as compared to something that, if it's allowed to continue, could be more of a sign of a problem. One other neat little tip that I'll give is in regards to dogs when it comes to a potential problem with their teeth, or what we call tooth root abscesses. And every now and then, and I just treated one like this a couple of weeks ago, you'll actually see a swelling happen right under your dog's eye, and it may actually rupture open and drain a little bit. And everybody thinks, the owners think something's going on with the eye or there's something with the skin. It's usually the sign of actually a problem with their tooth. Again, an important reason why you want to have their teeth checked regularly, because the tooth roots go way up there and they can get an infection, an abscess, and instead of abscessing and draining out through the mouth, they drain out up through that opening. So that's really important to remember when it comes to those things. So if you see a swelling like that on your dog and they appear painful or don't want to eat or something like that, it's not mainly because they've got something going on here. They've got something going on inside that has to be dealt with, and usually we have to go ahead and extract that tooth. So all of those things are important, and you can always, again, talk to your trusted veterinarian for more tips as far as being able to brush their teeth and things to look for as far as problems. Now, we've talked totally about dogs and cats so far, and I haven't forgotten you horse people. I am going to, you know, as I said, dabble just a little bit into an important issue when it comes to horses. And what a lot of people don't realize is that a lot of times horses will demonstrate teeth issues by not wanting to eat. So they may be dropping weight, they may not be chewing their food as well. But there's also something very interesting, and it involves horses' teeth that grow continuously. I don't know if a lot of people know that, as compared to, you know, our teeth or dogs and cats' teeth, where once we reach an adult stage, they really don't grow anymore. Horses' teeth continue to grow. And the way a horse chews, especially when it's chewing its hay and grinding things down and stuff like that, kind of creates uneven surfaces on the edges of the teeth that we like to call points. And I'm going to show you a picture of what one of those looks like right now. And this is an example. You can kind of see right there that little point coming out along the side of one of the cheek teeth there. And these can be incredibly painful and actually cause cuts and inflammation to the inside of the mouth. If you actually look a little bit more towards this, just kind of a little bit to the right of center, you'll actually see a little bit of a injury or a cut wound there actually on the inside of the cheek. And that's very painful. And it can be very painful for horses to want to go ahead and eat and things like that. So that's something very important to be aware of as I bring myself back here. And what I'm going to show you now is a video just of a little bit of how that's done with horses. Again, I'm hoping in the future to do a whole episode just on horse care, where we'll delve a lot more into this and hopefully have some, you know, better video with one of the local equine dentists. So we are definitely going to try to do some stuff with that. But I did want to show you, this is taken straight off YouTube, you know, and you'll see it's actually kind of promoting products that are designed in what we call floating a horse's teeth. So if you ever hear that term, it basically means they're working on filing down those points. That's what that means. And you're going to see a lot of different ways to do it. This is using some power instruments, but it really gives the best video representation of what they're doing here. So we're going to watch that video for a little bit as I pull it up right now. And I may cut out a little bit in the middle because you don't need to see all of it, but I do want to show this filing of the points thing going on. Alright, so I'm just going to remove this real quick so we don't have any overlap. There we go. So that kind of gives you just a little bit of a view into exactly how the teeth are floated. There's more in there as far as other dental procedures with horses, but like I said, we're going to try to have a whole episode just on horses in the future, which hopefully, you know, we'll delve a little bit more into those types of things for all of you horse people out there. But, as I said, if your horses all of a sudden seem to be off their feed, if they don't seem to be doing as well, if they seem to be having trouble with a bit in their mouth that they never had before, check their teeth and have either a certified equine dentist or a veterinarian who specializes in equine dentistry do it. There's a lot of people out there that, you know, just claim to be able to do equine dentistry. You definitely want somebody that's reputable, and ask your veterinarian who they would recommend if they don't do a lot of equine dentistry themselves. So there are some very great veterinarians out there that do equine dentistry. Just make sure you ask your vet for a recommendation, or check out, as I said, PAVMA.org. Pennsylvania Veterinary Medical Association will be more than happy to point you in the right direction of a person who does really good equine dental work, because it can really make the difference sometimes even between life and death for a horse that doesn't want to eat. Good person who can come in, check all of that stuff. It's really important that we get their teeth taken care of. And like I said, there's a lot of other things that go on. I will mention a couple of things that you saw in that video. One, these horses were sedated. They had the areas nerve blocked, and they did have pain meds on board, so it wasn't like we were just doing this out of the blue without proper medication on board for these horses. The other thing you may have noticed right at the beginning was that weird, almost like jaws of life contraption that was on the horse's mouth. That really is just something that's designed to open their mouth and keep it open a little bit, because as you can imagine, anybody who's seen a horse's mouth, it is very difficult sometimes to get all the way back there, and we do need to be able to keep their mouths open a little bit so that you can get in with those tools to take care of those things. So those are all really important dental health tips. You know, I hope that in this episode we've kind of at least, you know, scoffed off the plaque of the surface of dental health with your pet, and you guys have learned a little bit, and now, you know, we'll understand a little bit more about why we are so forceful in really wanting to make sure we check your pet's mouth at least once a year. A lot of times those prophylactics, the videos that I showed you before, will be done once a year or maybe once every 2 years. It depends on the animal. I will say that the smaller breeds of dogs a lot of times are more prone to developing dental issues for some reason than sometimes the larger breeds, but so if you do have a smaller breed dog, you may be looking at more frequent dental prophylaxis procedures and even potentially dental extraction procedures. So just keep all of that stuff in mind, and again, make sure that you definitely you know, ask your veterinarian if you have any major questions about your pet's dental health. It is really important to talk to them about that stuff. And so the final thing that we are going to look at here is something that I started last episode, and I did say if anybody has any questions that they would like answered about their pets, and if I can try to do it, you can send them to shelterdoc38@yahoo.com, shelterdoc38@yahoo.com. I will do my best to answer them, and we did actually get a question in, and we are going to talk about that right now as we look at Doc's mailbag.
Dear Doc, I can lightly scratch my cat Tax near his hindquarters, and he makes these weird noises, licks the air, bends his head, and licks his chest. I was just wondering what kind of behavior is this? The noises he makes are so funny that I can't help but laugh. Thank you, Dawn R.
Well, thank you so much for that letter, Dawn, and I'm going to do my best to try to answer that question, but first, so everybody kind of understands what we're talking about here, I'm going to show a quick video, and again, I just pulled this straight off YouTube. You can search this for yourself, but I think this is kind of what she's seeing and what a lot of people will be seeing, you know, if you kind of hit that perfect spot on your cat's butt.
Taste this on for 2.5 hours.
So that's 5 to 6, 6 to 7. Oh, come out after 7. Or quarter to 8.
Yeah. Today, tomorrow, Monday, Tuesday, Wednesday and Thursday, 5 o'clock. If you go tomorrow, there's one in the afternoon at 1:40, or the next one's at 5 o'clock, or the next one's at 8:15.
Can you go tomorrow?
Yes. You don't have to.
Yes, I can go tomorrow. It's probably better actually tomorrow.
Yeah, we'll go tomorrow then. You. What do you mean, what's on?
Telly-wise tomorrow.
Nothing. Midway's on, that's 8 o'clock.
You probably won't be back for that.
Alright, so yeah, so those are the kind of things, you see a lot of, almost every cat will do it, some to varying degrees. Sometimes we see it more pronounced, sometimes in more overweight or obese cats. And so the question is, why do they do it, and what causes it, and things like that. And I did a little research into this, because you hear a lot of different answers, and I don't think anybody's 100% sure, but there are a couple of theories that are out there. And one is that whole area back there is very, very highly innervated. So you're just kind of hitting almost that perfect spot that, it just feels so good to them, and so they really enjoy it. So, and that's the way they kind of communicate things is through non-verbal gestures, basically, and that could be one of them. You do have to be a little careful when that happens. Some cats get overstimulated when that happens, and then all of a sudden can turn around and nail you. So you just have to be a little careful with that. But it's really not necessarily a harmful thing. If it's something new and you've noticed, and especially if all of a sudden they start kind of chewing on their legs or chewing on whatever is close by, sometimes your shoe or something, it can be a sign that that area is just not as easy to clean. So it's a much more itchy area for them, and you're just kind of really satisfying that itch. But again, if it's something new that you've noticed, you want to check that area out to make sure you're not seeing any kind of issues with fleas or any kind of minor skin infection that might be going on back there. Again, with more obese or very overweight animal cats, we do see that more often, where there are some minor skin infections and dry skin and deadened hair that's in that area, because they just can't get back to that area to groom themselves very well. So it feels really good for them, obviously. It's an area that probably itches quite a bit, and by you getting in there and constantly scratching it for them, it's just going to make them feel that much more better. We have a cat here, Tilton, who obviously I'm ashamed to say is a touch overweight, and we're trying to work on that, and he does that same very thing. He will just go in and, if you just hit that right spot, he'll just start, making those motions, making those noises, and just start licking and chewing on things. So it's not anything major to worry about. It is hilarious sometimes to watch, especially because every cat will be a little different in their reactions to it, but that's usually what's going on. So I do thank you, Dawn, for writing in that question. If anybody else does have a question for Doc's Mailbag, be sure to send me a line at shelterdoc38@yahoo.com. Again, shelterdoc38@yahoo.com. I will do my best to answer it, hopefully on a future episode, and who knows? I might learn something as well as you. That's the wonderful thing about being in the veterinary profession, is you never stop learning, and there's something always new to discover or explore or figure out about animals that you really never knew could potentially be going on with them. So that is about going to do it for this episode of Dr. Langlois Live. I hope we did answer some questions about basic pet dental health and satisfied your curiosity about it, took away a little bit of the mystique and mystery of what goes on when your pet undergoes a dental procedure and things like that. And as always, if you have any questions about anything that might be going on with your pet, I'm going to take one more quick look at our live YouTube stream here. No questions, and that's perfectly all right. So hopefully you are catching this still live, or you're going to catch it on the replay. But again, I do want to thank everybody for tuning in for this episode of Dr. Langlois Live. We will be back in March with another episode, and right now it looks like it's going to be talking about all the creepy crawlies and the fun little critters that we try to protect your pets from, especially with the weather starting to hopefully turn and get a little bit warmer. So we're going to talk a lot about flea and tick prevention, as well as the reason you want to keep year-round flea and tick prevention on your pets these days. So that is going to do it. I am Dr. Bryan Langlois from the Pet Pantry of Lancaster County, as well as the Pennsylvania Veterinary Medical Association, reminding you as always to take your pet to the vet, not the net. Have a good one, folks.
Dr. Langlois Live is made possible in part through help from the Pennsylvania Veterinary Medical Association. For all the up-to-date information for your pet's health, check them out at pavma.org. Please consider supporting these organizations that are very important to Dr. Langlois. The first is the Pet Pantry of Lancaster County, meeting the need for animals and their families in Lancaster County. Visit petpantrylc.org. Second is Pennsylvania Racehorse Rehoming, Rehabilitation, and Rescue, providing that all-important second chance at a great second life and career for retired racehorses off the racetrack. PARacehorse.org.